In 2018, a 45-year-old woman came to the emergency room at the small community hospital where I work. Let's call her Anna. Not her real name, but I want to protect her privacy. Anna was previously healthy, but had accidentally taken a dangerous overdose of Tylenol and was in critical need of a liver transplant. We knew we would have to move fast to save Anna's life. Now, transplants are specialized procedures that need to be done in large medical centers, so we started calling the transplant centers. Because of Anna's condition, the transplant center at a large hospital quickly approved the transfer. We started getting Anna ready to go. Then, the finance department at the other hospital called. What kind of insurance does your patient have? Medi-Cal, we said. That's public insurance for low-income Californians. Suddenly, there were delays, roadblocks, additional authorizations needed, even questions about her legal status. Meanwhile, Anna was getting worse. We called other hospitals, desperate to find a transplant center that would take her. But the word Medi-Cal was like a curse. By then, Anna was in a coma. Our pleas to other hospitals went nowhere. And within days of coming to our hospital, Anna died. I'd like to be able to say this is an uncommon story, but it isn't. I'm Elaine Batchlor. I'm a doctor and the CEO of Martin Luther King Jr. Community Hospital in South LA. At my hospital, we beg other hospitals to accept patients they don't want to treat. Not because those patients don't have dire health needs, but because they are poor. Anna is just one example of our nation's separate and unequal health system. In 2020, COVID-19 has given us thousands more. For every white person who has died of COVID, 2 to 3 Black and Latinx people have died. But if 2020 has brought us a plague, it's also given us an antidote: protests. A large and inspiring social justice movement led by and for people of color. Protests and plagues are both connected to unfair and unequal systems that have existed for too long. It's time for those systems to end. I'd like to tell you about 3 protests that shaped my life, that led me to medicine, to South LA, and to this stage, and what we can all do to end this nation's separate and unequal health system. So let's go back in time. This is the Poor People's March on Washington in 1968. Can you see me? I was there somewhere. I was a young girl on my father's shoulders, witnessing one of the first Occupy movements. My parents were social activists. They attended Dr. King's I Have a Dream speech. They believed in education. They fought to buy a house near good public schools, even though our white neighbors refused to speak to us for years. Part of my education came from my uncle. He was a self-styled revolutionary who fed me books by Stokely Carmichael and Angela Davis. My family told me, you don't have to accept the status quo. Because of them, I grew up to be both a doctor and a social activist. I wanted to heal bodies, but I also wanted to heal the systems and attitudes that make us sick. This is Watts. It was August of 1965. It was a week when the Black and brown people of South Los Angeles rose up to protest police brutality and more. Watts was created by racial covenants that prevented Black people from living in most of Los Angeles. It became a community that lacked jobs, transportation, decent schools, even a hospital. A new public hospital was one of the few good things that came out of the Watts riots. It had a promising start, but over time, a shortage of good doctors and other problems put patients at risk. When it closed in 2007, it felt like going back to 1965. Then something happened that made me believe in the possibility of progress. A group of committed leaders from both the public and private sectors took a stand. They decided to create a new model for delivering healthcare to an underserved community. The result was my hospital, Martin Luther King Jr. Community Hospital, which opened in 2015. We're a private, state-of-the-art hospital offering quality care to the people of South Los Angeles. When we first started our hospital, we knew it would be hard, but it was harder than even we expected. We expected to care for 40,000 patients a year in our emergency room. By 2020, we are seeing nearly 3 times that number. We were stunned by how many people came to our hospital dying of preventable diseases. Diabetic amputations and wounds, both preventable, are the most frequent surgical procedures we do. Then there's sepsis. It's an overwhelming infection that's often the end stage of poorly treated chronic illness. It's our top inpatient diagnosis. We have babies born to women who've had no prenatal care. We had a woman who didn't know she was having twins until she had them at our hospital. She had gone 9 months without prenatal care. Now, it's not that people who live in our community don't want to see doctors. It's that too often they can't. The average community has 10 times more doctors than South LA. We're one of the most medically underserved places in the nation. The reasons are the same as those that fueled the Poor People's March and the Watts riot. Healthcare, like so much in the US, is separate and unequal. Remember Anna, our patient who needed a liver transplant? Remember her insurance? She had Medi-Cal, California's version of Medicaid, health coverage for the poor. Medicaid was signed into law 11 days before the Watts riots. It was supposed to help poor people, and it did, but it also ghettoized them. How? Well, if you work full-time, you likely have private insurance provided by your employer. Despite concerns about the cost, people who have private insurance generally like it. If you're retired, you likely have Medicare. This is public insurance, but far better funded than Medicaid, and as a result, better quality. If you don't have Medicare or private insurance, you're probably stuck with Medicaid, Medicare's poor cousin. In California, doctors who treat Medicaid patients get paid half of what Medicare pays. Nationally, the rates are not much better. Now, I want to ask you, if you were a doctor, maybe carrying hundreds of thousands of dollars in medical school debt, would you work with patients who pay you 50 cents on the dollar? It's not that doctors don't want to work in poor communities. They can't afford to. As a result, South LA is missing 1,200 doctors. Little wonder diabetes is 3 times more prevalent here than in other parts of the state, and life expectancy is 10 years shorter. And no surprise, COVID-19 that preys on people with chronic health conditions has hit South LA hard. When people use abstract phrases like systemic racism, this is what they mean: that certain lives, Black, Latinx, poor, are valued less than others. Nearly all the patients at my hospital are Black, brown, and low income. Most are on Medicaid or uninsured. With those metrics, we should be failing. But guess what? We are succeeding. Here's how. We decided not to accept the status quo. We developed a public-private partnership with local, state, and federal funding and strong champions for our work. We said, if there aren't enough doctors in South LA, let's change that. So we started our own medical group. Our foundation helped us raise money so we could pay our doctors market rates. That allowed us to recruit socially minded doctors from the nation's leading academic centers. We now have 3 locations where our doctors see patients and prevent disease from ending as a trip to the hospital. Now, hospitals are important. I run one. They're critical, but they're the heavy artillery of healthcare. And they come with a price tag to match. Regular visits with good community-based doctors cost less and save more lives in the long run. Here's what else we did. We rejected the idea that some lives are worth less than others, because if you believe that, you deliver that. Instead, we insist on quality. In the 5 years since we've been open, we've received A ratings for patient safety. We're in the top 10% nationwide for patient satisfaction. We're in the top 7% for use of health information technology, and we've been called the hospital of the future. But Martin Luther King Jr. Community Hospital is just one hospital in one community. The quality that's happening here should be happening everywhere. If it did, our health system would have a chance of being equal, and we'd save a lot of lives. For Martin Luther King Jr. Community Hospital to happen everywhere, we need collective action. Which brings me to the third protest in my story. Black Lives Matter has given us a moment of opportunity to build health equity across the nation. Now is the time for Americans to get behind healthcare reform. This means providing quality doctors, health coverage, and community-based care everywhere, from affluent to low-income communities. At the very least, it means raising Medicaid rates to Medicare levels. This would put action behind the calls for equality and justice. And our patient, Anna, who died waiting for a transfer, she might be alive today. Let me end on a personal note. This is my family. My 2 sons, Aiden and Julian, belonged to a politically active household. They were students for Bernie who spent their spring breaks canvassing for candidates in neighboring swing states. They each started a political action club at their school. Aiden and Julian have seen a lot of ugliness in their young lives, but they've also seen progress. They helped a Black man get elected president. They've seen the idea of universal health care move from the fringe to the mainstream. Aiden and Julian started college this fall in the middle of the COVID pandemic. Julian wants to be a doctor and an activist like his mom. Both of them understand that Martin Luther King Jr. Community Hospital, my hospital, our South LA hospital, should be the rule and not the exception. And they're fired up to work on that. If the past year is any indication, millions of other Americans are fired up too. So let's take the energy of this moment and harness it to create a better future for our country. Let's raise our voices. Let's march. Let's vote. Let's challenge the status quo. Because if we do, we can and we will in this nation's separate and unequal health system. Thank you.